On this episode of Paramedics,
Gavin, open your eyes.
A shocking motorcycle accident leaves a family man in critical condition.
Is everybody ready?
Can emergency surgery keep him alive?
If I don't get it right at this point, the consequences are going to be dire.
Why just silly?
Amanda and Taz help a little patient with a big attitude.
Okay. Well, that's not very nice.
My daughter's in labour and she's trying to push.
And Cam races to help a baby in a hurry.
Uh-oh, game on. It's happening. I think I'd better get in there pretty quickly.
I'm pushing.
So tell me exactly what's happened.
There's a motorcyclist come around the bend and went off the road and hit the ditch and...
Okay.
Really, at the moment, he's pretty smashed up.
At the state's Emergency Communications Centre, a call for help has come in from the scene of a motorcycle crash 200 kilometres away in the Victorian High Country. Intensive care flight paramedic Matt is now on the way with an air ambulance crew to rescue the motorcyclist.
Fully departure, maintain upwind, full advise, clear takeoff. Airspeed's alive, come in.
Okay, is he awake?
What, he's awake yet?
Yeah, okay.
He looks in a bad way though.
We'll keep the helmet on, okay?
Maybe leave the helmet on. Leave the helmet on.
Yeah.
Don't do it. Yeah, just loosen it.
The accident victim reportedly has a collapsed lung and is in danger of going into respiratory arrest.
We suspect that perhaps a broken rib has punctured the covering of his lung, allowing air to come in around his lung. And the only way to relieve that is by putting a hole into the chest to allow that built-up pressure to escape. If you don't allow that to happen, that person will go on and die.
Dust everywhere.
The helicopter is landing at Mansfield Airport, where the road crew is waiting with their critically ill patient for Matt to take charge of the situation.
On the ground, farm 0.
What's going on? So I've got Gavin here, he's 57. Gavin was riding a motorcycle approximately 80 kilometres an hour. I failed to negotiate a bend.
Gavin was taking part in a charity ride when he lost control of his bike and crashed into rocks. His son Billy was travelling ahead of him at the time of the accident.
When I rocked up to the scene, I seen his bike upside down in the ditch, and it was, I didn't know if he was dead or alive. I was just telling him it's going to be all right. The ambos are on their way. Yeah, it was just a horrible feeling. Horrible.
Got a pelvic wrap on? Pelvic wrap on. Gavin, give your toes a wriggle for me, mate. Good man.
Miraculously, Gavin is showing few signs of external injuries due to his full leathers and helmet. But internal injuries are now threatening his life. A suspected collapsed lung is Matt's first priority.
Gavin, how you going, mate?
Pretty better.
Yeah. Mate, your oxygen levels are pretty low. I'm concerned you've collapsed your lung, which is why they put that needle into your chest, but it's not doing a great deal for you at the moment, mate. So we're going to try and give you a bit more pain relief and see how you go with that and see if we can get you to breathe better. And if you can't, I'm going to have to put you to sleep so we can take over your breathing and get you back to Melbourne, mate. Sound reasonable?
You're the boss.
Righto.
Gavin is very sick. He's got a really fast heart rate. He's got a really fast respiratory rate. His oxygen levels are very, very low, and his blood pressure's low as well.
Nice big best for me, Gavin. You're doing really well, mate. We'll give another 20 of ketamine, please.
I can do that.
So I'll attempt to do a needle decompression on Gavin first, and if I don't get the results that I want from that, then I'm going to be forced to take more drastic action.
So sharp out, guys.
You need to move. You need to move. Thank you.
In Melbourne's northwest, Amanda and Taz are responding to a Code 1 paediatric case.
We have been dispatched to a 7-year-old female fallen to the ground while roller skating.
Poor little girl.
So obviously we have to worry about her spinal.
Absolutely. She's fallen straight on her coccyx bone. When a paediatric job comes through and it sounds very serious, obviously all of our stress levels increase significantly.
You know, my daughter, she does gymnastics. The minute she's heard You know, those paramedic...
It's a different story, isn't it?
Yeah, I'm not a paramedic anymore.
No, you're dad.
I'm just that sucky dad,
Yeah.
you know? This girl has fallen on concrete, and sometimes the impact can result in injury to their legs, to their back, and most importantly, to their spine and head. You don't want to snatch the childhood from any child because of these kind of injuries, because that can have quite a detrimental, life-changing event in any kid's life.
So we've got Madison here.
Hello, Madison. So tell me what happened.
I was riding on my skate
Yes?
and then I fell on my bum.
You fell on your bum. Did you hit your head? No? I'm gonna feel your back. Let me know if I hurt you anywhere, okay? I'm gonna start with your head. How old are you? 7. Hey, I've got a 7-year-old at home. Her name is Anya. It hurts there, where my finger is.
On assessment, we discover that Madison has some neck pain and some lumbar pain. This is concerning to us as we're thinking, oh, maybe she has done some spinal damage here.
Sharp coming out.
Back in the Victorian High Country, motorcycle accident victim Gavin is in a serious condition with a collapsed lung.
Gavin, open your eyes. Good man.
Using a decompression needle, Matt has attempted to release a life-threatening build-up of air from inside Gavin's chest cavity.
Righto, so ketamine's kicking in, sats are up to 84.
Still got a rest rate of 60.
Yeah.
But the procedure has made little difference. So Matt now has no choice but to try and put Gavin into a coma and take over his breathing entirely.
Gavin, I'm going to give you some medicine very soon. It's going to make you very sleepy. Your oxygen levels are still very low, so we're going to put that little tube into your mouth and we're going to fly you back to Melbourne in a moment, okay?
There is so many factors that make this difficult. I know that as soon as I take the mask off and he stopped breathing for himself, his oxygen levels are going to rapidly deteriorate, which could lead into cardiac arrest. So we've got to perform this procedure as quickly as possible.
Just lifting you out, bud.
Sorry, bud.
Yeah, you're all right. Okay, I have the ketamine.
Yep.
So 2 mils, 20 milligrams. 1, 2.
Is everybody ready?
Yeah, we're ready to go.
If I don't get it right at this point, the consequences are going to be dire. So we need to get it right first time.
Just get ready.
It hurts there, where my finger is.
In Melbourne's northwest, Taz and Amanda are examining 7-year-old Maddie, who landed heavily on concrete after she fell off her roller skates.
Any pain?
She's in severe pain, and they're worried there could be damage to her spine.
It's hurting, yeah? Okay. While we were assessing Madison's spine, straight away she felt tenderness, and I looked into Amanda's eyes and we both agreed, yep, that's something serious. Can you feel the tickle? Is it the same in both legs? Okay.
Although Maddie does have sensation in her arms and legs, the pain in her neck is still a major concern.
So you don't move, okay? Try not to move your head, neck, everything, okay? Just stay still. So we'll take her to Royal Children.
Yep.
All right, Madison, I'm gonna give you a little medicine which is gonna help you with this pain. Take a deep breath. Keep doing that. Good girl.
So the challenge now for Taz and I is to move Madison from the couch onto the stretcher.
Just stay there for me, Madison, nice and straight, okay? I'm just going to hold your neck, okay?
On 3.
Can you tuck this arm underneath you?
Any movement with a spinal patient can cause what we call secondary spinal injury. So it is pivotal that we move this girl with the utmost precision.
It's okay, sweetheart. You're okay, darling.
It's all right, darling.
Use this stick. Use this stick. Good girl.
She's distressed, she's crying, she's upset, she's in pain.
All right. Is it hurting? Yeah.
And on top of that, we got this awkward extrication from couch to the stretcher.
It's okay. You're okay.
That ketamine's on
Just
board.
turn that suction on and have it available for them, please.
Yeah, sure.
Up in the remote Victorian high country, Flight Paramedic Matt is trying to save his critically ill patient after an horrific motorcycle crash.
Righto, guys, so this is the plan. He has got oxygen sats at 74% at the moment, which is very low, obviously. So it'll be a one look. If I don't get a view straight away and he starts to desaturate very quickly, I'll pull out early and we'll go straight back to back valve mask ventilation. Is everybody ready?
With oxygen levels still too low, Matt puts Gavin into an induced coma and takes over his breathing.
Saturation still holding.
Gavin's wife Sharon had been waiting at the charity ride finish line when she heard the news.
I'd been told that he'd been put in a coma, but I didn't know the extent of his injuries. It was bad. It was bad. We've been together for 30 years. He's my soulmate, I suppose. Yeah, he's my best friend.
We've got sats at 74 at this stage.
So there's a build-up of pressure from both air and also blood inside his chest there.
Gavin is still not responding to treatment, and time is now critical. With hospital 30 minutes away by helicopter, Matt has no choice but to carry out one of the most risky procedures that can be performed by paramedics in the field.
Now, he is likely going to tension with us doing this, so I would like to move fairly swiftly.
Radial pulse.
So the next thing that we need to do is what's called a finger thoracostomy, which is an invasive procedure where we make an incision into the side of the patient's chest so that any pressure that's built up inside surrounding the lung can escape out of the patient's chest.
So sharp out, guys.
Sharp out.
He's a big boy, so locating his ribs can sometimes be quite hard, so we've got a fair bit of tissue to cut through. It's a fair way in.
Yeah, we'll just wait until Matt's
There you go. There's your hemothorax.
Yep.
The blood and air have been released from Gavin's chest. Now the team must wait to see if his oxygen levels have improved enough to get him into the helicopter.
There's definitely air coming out with each breath there. The bleeding seems to be slowing down as well, which is good. Righto, sats are 93. Can we have a unit of blood, please, mate?
Push this in.
The oxygen levels have improved, but Gavin's low blood pressure is now the problem.
Let's get that blood up and going. Get a 12-lead ECG, make sure we're not missing anything.
I'm very concerned about Gavin. I've taken him from a high conscious state and I've put him to sleep. I've cut a hole in his chest. I've let air out. I've let blood out. I'm still very concerned for him. His blood pressure's low. His heart rate's fast. He's bleeding somewhere else. So what he needs is to be moving towards a hospital.
Let's get him across and get him sorted. He needs to get to Melbourne.
Emergency services.
Tell me exactly what's happened.
My daughter's in labour and she's trying to push.
In the Emergency Communications Centre, an urgent call is in progress from the Mornington Peninsula. The woman is worried her daughter is about to give birth at home.
And how many weeks pregnant is she?
38.2.
Okay, and is she having contractions?
Yes, she is.
A couple of kilometres from the caller and her pregnant daughter, single responder Cam is sent to assist.
So 38 weeks gestation, imminent delivery, 30-year-old female. We're right on top of this one. Not really going to have much time to think about it.
Unbeknown to Cam, the patient's labour is rapidly progressing.
Now the ambulance has been arranged for her. Where is she now?
She's in her own place.
Okay.
What is just broken?
All right.
Her husband's just arrived home.
Good.
Joel, just put some towels on the floor. You right, bud?
64, we've got 61, 61.
It's all right, Bubby, you're fine. The ambulance is coming. She's starting to push.
Okay.
Paramedics sound like they've just arrived.
All right, good.
She can feel it crowning.
When you're going to somebody in labour, you're thinking, oh, is it complicated? How many births have they had? Is it twins? Is it triplets? Is it a breech birth? Who am I here to see?
Krista. She's crowning.
Yep, won't be a tick, mate. I'll just grab some gear.
A crowning baby can be just seconds away from birth. Cam has no time to lose.
Paramedics are here.
You just let me know when they're inside.
They're walking up the driveway.
So, where's Krista?
Through to the
Baby's
right.
crowned, it's starting to come through.
Oh, good on you. Hi, Krista. First pregnancy, second pregnancy? Second. Are you having regular contractions?
Yes.
At this point, there's no getting out my equipment or getting ready. You try and put on your I'm not concerned face, but there's a million things running through my mind. Where's Dad? Can we get a couple of other towels? Breathe, 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 breathe. That's all right.
I'm pushing. I'm pushing.
Do you have to push?
Yes.
Okay. Breathe, 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 breathe.
Now, Maddie, we're just going to put a little collar around your neck, okay?
Like a big necklace. Keep it straight, don't move your head. How's that, darling? It's okay, don't move your head for me.
Try not to move your head.
We've got to use our words because you can't use your head, okay? Good girl.
7-year-old Maddie has fallen over while roller skating and is still in severe pain.
Just keep this leg straight. Okay.
Good girl.
Good.
Taz and Amanda fear she has damaged her spine.
Well done.
That was like a slide.
How was that?
Yeah?
Madison's mum, Susan, and dad, Greg, are still in shock.
As a paramedic, I would love to say to any mum and dad, look, everything is okay, but sometimes it's not possible because you don't know whether that's the case or not.
This is a bit of a weird adventure, isn't it? That's it, thumbs up. I'm happy with that. If you don't want to talk, thumbs up, but let's keep this head nice and still, okay? Hey, Oliver, can you pass me that bandage? Oh, such a good helper.
We've employed some help of young Oliver, Madison's brother. He's really concerned about his sister.
Okay, here we are, Maddie.
Ollie, do you want to go up and give her a kiss?
Let's hope this kid, even though she's fallen, she's hit the concrete, but let's hope she hasn't done a major damage to her spine. All right, we're ready to go.
Happy to roll?
Yeah. Now, Maddie, you let me know if at any stage your pain gets worse. Okay? So we can give you more spray. Well done. Thumbs up. Perfect. Your brother looks very concerned for you. Looks like a lovely young brother, yeah? Okay. That's one thumbs down.
He was smiling when I got in there.
Okay. Well, that's not very nice.
He was laughing and he was clapping his hands.
No, he wasn't clapping his
Sometimes he's annoying. Yeah.
That's what brothers are like.
That's what boys do.
Yeah.
Andy?
Boy, just silly.
Do you know what, Maddie? If you stay with that attitude for the rest of your life, you'll be doing all right.
Taz and Amanda have done their job helping Maddie forget about her pain.
We're at hospital.
But Mum Susan won't be able to relax until she knows whether there's any long-term damage to her daughter's spine.
This is the special ambulance entry. Only special people get to come in this way.
Now, I'm not putting a collar back on, but we are all aware that he's got potential for cervical spine injury. This should keep his head nice and in alignment. All right, guys, someone needs to hang on to the blood and someone needs to take control of the monitor.
At the Mansfield Airport, Flight Paramedic Matt is satisfied his critically ill patient Gavin is stable enough for the 30-minute helicopter trip to Melbourne's Alfred Hospital.
You right to go?
Yep.
He's still critically unwell at this point, and so I don't want to hang around at scene. The patient needs to be in hospital with surgeons standing over the top of him.
Can I just get someone to be in charge of squeezing this blood for me, please?
As well as a collapsed lung, Gavin's blood pressure is dangerously low.
Let's get him in and get him on the ventilator.
Matt also suspects the 57-year-old could be bleeding internally from his high-speed motorcycle crash.
So we need to get the fudge out of him. He's been here too long now. We just need to squeeze that blood into him as much as we can for the moment. Just keep an eye on his SpO2, keep an eye on his blood pressure.
Squeeze that in. We want to try and get that BP sorted. Low as possible, please, on the way back. Cool.
The helicopter needs to stay at a low altitude to prevent any further pressure build-up inside Gavin's chest.
I still have no lung inflation on this side. I cannot feel his lung.
This is a physically and mentally exhausting job. I've made decision after decision after decision with this patient at this stage, and so my brain is going at 1,000 miles an hour. He's still very, very unwell. He's still in a uncontrolled environment in the inside of the helicopter. You know, he still has the potential for things to go wrong with him.
Not like what his BP's doing again at the moment. There are 150 coming down.
When we talk about what I enjoy in this job, I enjoy going to work and helping people when they really need it.
Thanks, guys. Thank you.
So when we land at the Alfred and I can see the medical staff and the medical team come to assist me and to take over care of the patient, it is a big sigh of relief.
Hi, how are you going?
How much blood does he have?
Is that 4 units now? Yep.
We've worked really hard with this patient for the time that we've had him, but it is also nice to be able to hand over to an emergency department where they've got 20, 30 people that are standing around to help him and assist him.
But the battle to save Gavin is a long way from over. His life is now in the hands of the Alfred Trauma Team.
Where's Dad? Can we get a couple of other towels? Breathe, 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 breathe. Are you having regular contractions?
Yes.
In Mount Eliza, single responder Cam has just arrived to help second-time mum-to-be Krista give birth. Krista's mum Joyce called paramedics when she realised it was too late to get her daughter to hospital.
She was having contractions probably 4 to 5 minutes apart. She sort of started increasing, but certainly wasn't concerned. And so then she said, no, I'm going to push now. And then she said, call an ambulance. So for her to know that, I thought we're in trouble.
That's all right.
I'm pushing. I'm pushing.
Do you have to push?
Yes.
Okay, that's great. That's great. Well done. Nice and easy. Nice and easy. That's the way. And rest, 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 rest. Breathe, breathe. Baby's coming. That's all right. There we go. There we go. There we go. Little girl. Huh? Where's Dad? Yeah. Come in, mate.
The girl.
How quick was that?
There you go. There you go. Hey, congratulations.
Thank you.
Yeah.
Hi, darling.
I've done about 3 births, but most of them, as I arrive, the baby's just delivered. So this is probably my first real catch. What's her name?
Everly.
Everly. Yeah. Lovely. Lovely. Okay, I'm going to clamp. Well done, you. Do you want to cut the cord, John?
Yeah, I did in hospital.
That'd be great. A couple of times. That's the way. Well done. Good on you, mate. Yeah. Thank you. Here's baby.
Just wait till I got her, yep.
Great. Everly's crying, so I'm happy that her colour's improving. The family looks so happy straight away.
And look at my granddaughter. Hey, precious. Oh my God, she's got lots of hair.
Everly's well, and it's just a matter of bringing Everly's little brother in and getting them to meet each other for the first time now.
Hudson, look. Hey, look at all the babies. There's your little sister.
As Everly gets to know Dad Joel, Big Brother Hudson and Granddad Glenn, Cam stays with Krista.
Do you feel the urge to push or anything? Just one baby? Gotta ask, gotta ask.
He's still waiting for her to deliver the afterbirth, or placenta.
Lots of water's coming out.
Yeah, you got a little bit of blood coming out. I'm going to monitor Mum, so maybe just a BP cuff. I haven't forgotten that now I've got 2 patients there. I've got newborn baby that I've got to keep an eye on, and I've got mum.
I'm just assessing that bleeding, right? So you're just bleeding a little bit, little bit.
Normally the body is able to control the bleeding as the placenta releases from the uterus, but if it doesn't, Krista might need my attention very quickly.
Chest pain, Flinders Street Station.
In the centre of Melbourne, new partners Eamon and Mike are on their way to an emergency at the city's busiest railway station.
It's a 60-year-old person with a pain in chest that's going to the back. Says past history, 6 heart attacks. Could be something in this. All right, you're clear left and no pedestrians. You have plenty of room on the left now.
The pair have only been working together for a few days, and this could be their most challenging case so far.
This could be something serious. He could be having AAA if it's going into the back. He could be having a STEMI. He could be having anything.
So alarm bells are going off for me. It could be a legitimate massive heart attack, which we call a STEMI, or a problem with his aorta where it's dissecting. That can be minutes to live.
We're pretty much right on top of this. You're going to mount this curb. I'm just going to come up through here. Yeah, sweet as. Tram has seen you.
Eamon is only 2 years into the job.
I think when you first get dispatched to big jobs, when you're new in, they're terrifying. But I think as you get more comfortable, when the big work goes off, it is exciting and you go, this is what I do this job for.
Hi, mate. In here?
Yeah, in the booth.
Roger. Is this the best way to come in?
What is he going to get?
Lead the way, please. Great.
Waiting in the police booth is 62-year-old John.
What's happening?
I've had 6 heart attacks.
Okay.
I had my last one approximately 3 years ago.
Sure.
5 of them,
yeah.
I could feel the symptoms coming on.
Sure.
And I was a truckie, so I used to unhook and just drive myself to hospital.
Okay.
The last one that happened, it just dropped me.
Yeah, right.
There was no symptoms. That's when they put the stents in.
Okay.
It's not my heart, my aorta artery.
Okay, so sorry, your aortic artery is blocked or blocked? All right.
Just nice and still, just for 15 seconds or so.
Eamon is now taking an ECG of John's heart.
All right. What about other medical problems?
I have high blood pressure. I did have high cholesterol.
Does your doctor tell you should take tablets for those?
Oh, I haven't seen a quack for a while because I've got a bit of family problems like burying my mother.
Okay.
6 months ago and on the way to the hospital. One of my sisters and her daughter had an accident.
Oh, jeez, mate.
So my sister was on life support. We only turned her like 2 months ago.
Yeah,
oh, mate, I'm sorry.
So you haven't been too worried about yourself?
Unfortunately, we hear a lot of sad stories in paramedicine, but John definitely strikes me as someone who's had a really rough go.
So your heart tracing looks suspicious to me that you may be having another heart problem?
So his health has really taken a back seat, and today I can see that it's caught up with him.
Can you tell me a bit more about this pain in the chest that's going to the back?
It's not in the chest, it's in the back and it's like indigestion pain.
Because his pain's going from the chest into the back, and he mentions to me he's had a problem with his aorta in the past, I'm now more suspicious that maybe he's having a dissection or a tear in that major blood vessel, which is critical.
John, your blood pressure indicates to me that I think you're having a problem with your aorta that is very, very serious, and we need to get you to the hospital pretty quick stick, so I'm not going to muck around.
John could die. He needs to get to the hospital.
Here's Mummy, look.
Go in and see the new baby.
Back in Mount Eliza, a remarkably relaxed Krista is now bonding with her new baby. It's only been minutes since Everly's dramatic arrival on the bathroom floor. While Krista is still having tiny bleeds, Cam is happy for her to show off the new arrival to the rest of the family.
They desperately wanted a girl, so she's very, very, very happy.
Her colour's great. Yeah. Oh. It's not often that you get to hold a newborn. That was my first cuddle with Everly, just enjoying the moment. Look at you. To assist someone with bringing a new baby into the world is more than a privilege. Yeah, it's great. I'm rapt to be part of it.
Although baby Everly is healthy, Cam's job is by no means over.
How are you feeling?
Feeling more pressure.
Crampy pressure. Okay. We just haven't delivered the afterbirth yet, so okay. I've got the placenta that hasn't delivered, and we've also got mum that still has the risk of having a bleed. It's okay at the moment, but if it progresses, things could turn from fun, happy times to critical very quickly.
You'll see Mummy tomorrow.
Your blood pressure indicates to me that I think you're having a problem with your aorta that is very, very serious.
At Melbourne's Flinders Street Station, Mike and Eamon are worried their patient is in a critical condition.
It's really this back pain, unequal blood pressures that we're worried about, isn't it?
And with some sort of aortic history.
Yeah.
62-year-old John has already survived 6 heart attacks and is now showing symptoms of an aortic aneurysm.
All right, we are going to get you onto the bed. As soon as we both look at that monitor and see the blood pressure is significantly different between the left and right arm, silently a little switch flicks in our brain and we go, let's go.
You got him?
Yep, I have him. The aorta is the biggest blood vessel in your body. All the blood that comes out of the heart goes through that. So if it tears, you start bleeding out internally. And it's not a bleed I can put pressure on, you need immediate surgery. Yeah, not a pain in the arse at all. You're a complicated man though, John. We want to get him on the stretcher, in the ambulance, away from Flinders Street Station to a cardiothoracic surgeon, really quick.
In Mount Eliza, little Everly is on her way to hospital with her own personal photographer.
You'll love these photos when we get there. Yeah, you'll be like, oh, do you remember that? Yeah, it's good.
The newborn baby is looking great.
Very good, strong heartbeat.
But Cam's keeping a close eye on Mum, waiting for her to deliver the placenta. Krista is still losing a small amount of blood.
Can you feel any more fluid loss? Trickle, contraction. Okay. It's not abnormal for the placenta not to deliver straight away. It can take a little bit of time. So it's a matter of just monitoring the bleeding, and as we get to the hospital, there's nothing else to really do. They're in very safe hands.
Okay. If needed, midwives will administer medication to help Krista deliver the placenta.
I think that once the adrenaline of everything that could go wrong hasn't gone wrong, then you can really digest and think about what just happened. You know, they've let me help them bring new life into the world, and it's an amazing experience.
Has he got you touching his leg? Sorry? Has he got you touching his leg as well? I thought it was just me.
You're not that special. All right.
In the city, Mike and Eamon are trying to keep their patient relaxed, but they are acutely aware 62-year-old John could be suffering a potentially fatal aortic aneurysm.
All right, so I'm going to pop a little needle in your arm.
Right now, however, their patient seems more worried about intravenous pain relief.
All right.
I've got a paranoia about I could never be a junkie.
You don't like needles?
I don't like them, but I won't. I'll try not to sit them.
All right, my friend. Borrowing your arm. It's going to be a sharp scratch.
Yep.
Big breaths. Ready, set, go.
We'll do a cigarette when I get you.
Okay. It's really important that you stay still, mate. I need you to
Sorry.
stay. That's all right. It's quite a classic situation. Older, trucky sort of bloke. You know, oh, the pain in my chest, it's nothing, mate, I'm all right. As soon as I get a tiny little needle out to give him some pain relief, nah. Okay, the needle is in.
But there is some good news for John.
Oh, mate, that left side of BP is now 180. It looks like that blood pressure reading that was quite low was just an outlier, so that's good. Are you good to start moving?
I don't know.
Yeah, man, just gently. It'd be great, thank you. On reassessment of the blood pressure, it's actually within the normal range. That could mean to me that it was just a false reading, it was a one-off. But I'm still concerned that the worst thing that could be happening to John right now is an aortic aneurysm. If it's just back pain, great. If not, we're getting him to the right spot pretty quickly. What number would you say your pain is on that 0 to 10 scale?
Oh, about 3.
About a 3.
It's just there now nagging. That's all.
Yeah. That pain relief will start to kick in a minute or so. And we're just around the corner from the Alfreds. This afternoon and this evening in the hospital is all about you. Let's get you squared away. Because you're no good to anyone if you're in the ground. So I'm going to do everything I can, and these guys will do everything they can to keep you around.
I know that, and I appreciate it.
Good man. There's definitely a sense of relief when we get to the hospital.
Sorry if it's a false alarm.
Nah, don't be sorry. No. You're telling me you've had 6 heart attacks, mate, so I hope it's a false alarm. That'd be excellent. It could be. That's why we need the hospital to check you out. I know John's not quite out of the woods yet, but there's a sigh and I go, oh, that was a bit of a prickly one.
Now, John, I was just wondering, Foxy here,
Yeah.
he needs some beard growing tips.
I do, actually. 3 weeks without shaving.
Well, you're lucky. I got to shave twice a day when I shave.
I bet.
Yeah,
I bet.
yeah, so...
Mate, I tell you what, better than not having to shave the face. I don't have to shave the chest either, so. All right, sit tight, mate. We'll take you in. I don't know if John's ever going to come out of hospital. I really hope that he does. But we never quite know what's going to happen on the other side of those hospital doors.
Seven. No. Yes. You can't eat 7. Yes, I can.
4 weeks after her fall, and it's happier times at home for Maddie. The 7-year-old had crashed off her roller skates, landing badly on concrete.
Is it hurting? Yeah.
Luckily for Maddie, there was no spinal damage, just severe jarring and bruising of her back and neck.
We were frightened for her. Normally a child, they fall over within a couple of minutes, you distract them, they're back on their feet. This wasn't the case this time, no. I was pretty scared, to be honest, yeah.
Let's go.
Today, she's allowed to strap on the skates for the first time since the fall.
How does it feel?
Scary.
Just a little bit scary.
Maddie's keen to get back up, so how can you deny her from doing it if that's what she wants to do?
I think that just shows the character that she is within herself, that nothing's going to hold her back. So yeah, I was super proud.
Yeah, definitely.
As for heart attack veteran John, tests showed he didn't suffer an aortic aneurysm. But after the recent scare, he's now following Mike's advice and making regular visits to his doctor for checkups. 6 weeks ago, 57-year-old Gavin was fighting for his life after crashing his motorbike. The injury toll included 14 broken ribs, a fractured collarbone, and a pelvis smashed in 4 places. Emergency surgery on a collapsed lung got him to hospital alive. But Gavin's wife Sharon and sons Jack and Billy are still coming to terms with just how close they came to losing him.
They grabbed her and Jack and Billy and took them in the room and said, this is 50-50.
When the doctor said that it's touch and go because he's so broken, I just thought, what am I going to do without him? Life won't be the same. That's what I was thinking.
Yeah, it's hard for them. But I'm here to tell the story. I don't usually cry. I'll be right when I get home.
Oh, I better make the most of it then, eh?
She's got a fair bit. She's got to learn how to wipe your bum.
Oh, no, thanks.
Chop your food up.
It'll be at least another 2 months before Gavin can attempt to walk again. As for getting back on a motorcycle, no decision has been made yet.
I've got 12 months or so to think about it anyway.
Exactly right.
He came through. He did. He's a fighter. And he's still fighting, but yeah, he'll make it. "8 weeks since their first rushed meeting, single responder Cam
is back at Krista's house
Hello. Hi, Krista. How are you?
for a visit of a much more relaxed kind.
Hello, Emily. Hello. We meet again.
Can you believe it's
behaved.
been 8 weeks
Nope.
today?
Wow.
Would you like a cuddle? Go, Possum.
Oh, I'm a bit cold as well. Oh, here we go. She's great. Oh, smiles. Hello, miss. When I first saw Everly, it was just like, oh, there's your baby. And then it dawned on me, yeah, I was part of bringing her into the world, which was great. A very small part. Krista did all the work, but I was there. Hello. That's a lovely smile.
I do think for some reason I was the calmest of everyone. I think I didn't have time to panic or think about anything else. She was coming and she was coming in a hurry.
I don't normally deliver babies, so I was a little...
Once we had time to reflect on the situation, I think we were quite excited that we'd have such a fun story to share. He arrived just in the nick of time and he was an incredible support during what was one of the most special moments of our lives.
Hello.